Good morning. I was in a group with Sarah Brookelman and Nolan Christensen, and I'm Austin Mindong, and I will be talking to you about your relative that has been dealing with cerebral palsy. A brief overview of cerebral palsy. Cerebral means dealing with the brain or the cerebrum, and palsy means a weakness or problem with the muscles. This is a disorder that affects an individual's ability to move and maintain posture and balance. And this is also the most common motor disability that is in children. It affects a person's ability to control their muscles, and this occurs as the brain develops, usually before birth. However, it can also be acquired early in life as well. And in many cases, vision, hearing, and sensation can also become impaired if if symptoms lead to that and treatment is not taken up initially or quickly. There are various types and classifications of cerebral palsy. The first includes spastic cerebral palsy, and this is the most common. It accounts for 80% of cerebral palsy diagnosis, and there are three types within spastic CP, and as you can see on the picture, spastic CP involves motor cortex damage in the top of the cerebrum. And the first type is known as diplegia, and this involves muscle stiffness mainly in the legs or in two limbs. And the second type would be hemiplegia, and this involves muscle stiffness on only one side of the body. And then the third type of spastic CP is known as quadriplegia, and this is muscle stiffness over the entire body. And there's also intellectual disability, and seizures can be common with this type of cerebral palsy, and this is also where you usually will find visual, hearing, and speech issues. The second classification of cerebral palsy is dyskinetic cerebral palsy, and in the picture you can see that this is the location that this affects is kind of in the middle of the cerebrum, and this is causing damage to the basal ganglia of the brain. And what is common with dyskinetic cerebral palsy is it is characterized for rapid or jerky movements, and an individual suffering from this type of cerebral palsy is dealing with very poor motor control of their arms, feet, and legs, and it can also be difficult for them to control their tongue, and they can have difficulty swallowing. The last classification of cerebral palsy is known as ataxic cerebral palsy, and this involves problems with balance and coordination, and they also usually have poor control over their arms, and this actually affects the cerebellum of the brain, and this type of cerebral palsy is the least common. Symptoms and assessments. These are symptoms that are in general. We'll look at symptoms that are more common for infants younger than 6 months or in infants older than 6 months. But symptoms in general include variation in muscle tone, tremors or involuntary movements, lack of balance and muscle control, slow movements, delay in speech development and difficulty speaking, delays in development of reaching various motor skills, difficulty sucking or eating, learning difficulties, seizures, and as well as favoring one side of the body, and also stiff muscles. And so in patients or in infants younger than 6 months, some common symptoms that you see more for that group involves their body is stiff or floppy at times, and they also have an overextended back or neck, and also crossed or scissored legs when you pick them up. In infants older than 6 months, some motor skills that you can see that are not developing is the inability to roll over. They cannot bring their hands together, and they also have difficulty bringing their hands to their mouth. Causes of CP, they can either be congenital or acquired. Congenital means occurring before or during birth. Some of these causes would include abnormal brain development, oxygen deprivation during labor and delivery, premature birth, placental complications, fetal strokes, and also bleeding in the brain. And then acquired causes, this develops after birth. This usually involves a trauma that occurs early on during life to damage either in the cerebrum or the cerebellum. And these causes can be head injury resulting from a fall or motor vehicle accident, shaken baby syndrome, and what that is when a child is picked up and shook violently, a near drowning experience, and also abuse are all acquired causes of cerebral palsy, and only about 10% of diagnosed cases are due to acquired CP. Diagnosis of cerebral palsy. Most diagnoses occur within the first 3 to 5 months, or 3 to 5 years of life, and this can be difficult to diagnose because the baby or your child is developing and growing, and it's hard to figure out initially what's common and what's not common in their development. But first, the physician will look at complete medical history of your child, see what common issues your child has been dealing with, and then a physical exam will be done, and then also a neurological exam, and this will be done by various testing. Some testing of this involves an electroencephalogram and EEG, and this is used to observe electrical activity of the brain. An MRI can also be administered, so as that can identify injuries or abnormalities of the brain. A CT scan can also be ordered, and this creates cross-sectional pieces of the brain and can find any brain damage, just another way of looking at the brain and seeing what's going on. And then a cranial ultrasound is usually done in really young children, as this is a quicker and more inexpensive way to get images of the brain. And then a blood sample may also be ordered to rule out any other possible issues that are occurring. Risk factors of cerebral palsy, these include premature birth, low birth weight, being a twin or triplet, a low APGAR score, and what that is you can see on the picture on the screen of the diagram there, and the infant is assessed when they are born based on each of these categories, and they get the higher score. The score ranges from 0 to 10, and the higher the score, the better. So if they have a low APGAR score, that can also be a possible lead to cerebral palsy. Breech birth is also another risk factor, and this occurs when the buttocks and the legs come out first. And then maternal exposure to toxic substances is also another risk factor. There is no known cure for cerebral palsy, but treatment to help improve the lives of those living with the condition can certainly be done. And this would involve medication, therapy, and surgery. So some common medications that are used is muscle or nerve injections, and this is used to relieve muscle tightness. And however, your child will likely need to come in about every 3 months. However, this can really help with their muscles, and this is a very, very beneficial type of treatment. Oral medication is also used, and this is used for relaxing the muscles as well. And these are taken to release muscle tightness as well, and or also reduce drooling if that is a common problem that your child is dealing with as well. Therapy, physical therapy can be used, can be done also to improve the muscles of your child and help them train their muscles to use them to the best of their abilities. Occupational therapy, and this can be done for a child to learn to gain independence at home or also at school. Speech and language therapy, help your child learn to speak and use their words well and speak clearer. And then also recreational therapy, any sports activities or any activities in general that your child can participate in that will help them improve their motor skills. And surgery is we like to prevent that if at all possible. However, if we believe surgery can benefit your child and improve their condition, that will be another form of treatment that can be used. Orthopedic surgery. This involves surgery that is used to treat bone, muscle, or ligament disorders. And your child may require this if they have severe bone or joint malformations that may arise due to their compromised muscle condition. And then also the cutting of nerve fibers. This is a surgery that is done as the muscle fibers are cut so that your child can deal with less amount of pain, and they won't be dealing with a great amount of muscle pain. And then prognosis and follow-up of cerebral palsy. So the life expectancy is not precisely known, however, and it can also widely range depending on severity. And life-threatening symptoms can arise at any given time. And early intervention is essential in order to give your child the best quality of life. And being productive in therapy and proper treatment to help minimize any problems is crucial. And your child can certainly live a happy life with cerebral palsy. It's just important to act upon the proper treatment and therapy that is necessary and that will benefit them in the long run. These are the sources that I found my research from, and if you would have any other following questions, I would be happy to give these to you if you would like to do research on your own.